Mr. Richard Horton, Editor-in-Chief of Lancet, Dr. Harvey Feinberg, President of the Institute of Medicine of the United States, Mr. Haranaka, President of JMA, and distinguished researchers in the area of healthcare who traveled all the way from abroad. Ladies and gentlemen, I would like to take this opportunity to extend my heartfelt gratitude to all of you in attending this international symposium in commemorating the launch of the Lancet special series on Japan. In publishing this special series, I welcome Leilin Campbell-san from Bill and Melinda Gates Foundation. We have been greatly supported by them. And China Medical Board, Dr. Lincoln Chen especially has been supporting our efforts. I would like to thank them all. The publishing of Lancet Special Series on Japan suggests one of the pathways Japan can embark on in the international society in the 21st century. In 1993, the World Bank published a report titled The Miracle of East Asia, which positioned Japan as an economic power and an engine for a flying geese pattern economic growth in Asia. It has been a long time since then. Going forward, we must not only endeavor to revive the dynamism of the Japanese economy, but also we must play out a responsible role as a leading, mature state in the world. As the world's population ages steadily, especially in Asia, many countries, excluding India, will be rapidly facing the issue of aging. And while many countries enjoy economic growth, social disparity will be widening amongst these countries, and these will cause social instability. Many countries, including developing countries, therefore, will be facing growing demand for social security. And social security comprises security of income, health, and welfare. Japan has maintained its international advantage, especially in the area of securing healthcare for the population. For both men and women, the life expectancy at birth is top class in the world. For women, since 1986, consistently we are in the top position. And in terms of healthy longevity, based on the independence of daily lives, for both men and women, we are at the top level in the world. So why could Japan achieve such a healthy society with such longevity? This was the initial question that triggered the publication of Lancet series on Japan. We considered that by responding to this question, we may fulfill our new responsible role as an advanced aging society and a leading mature state in the world. And it was this year, 2011, as we tried to respond to this question, that coincided with the 50th anniversary of the universal health coverage in Japan. I think you will easily understand as you read this special series that this did not come just by chance. And so that is one of the responses based upon our research. So in order to respond to this question, we first of all recognize that we need to hold a clear awareness of issues based on policy theory and widely collect health-related data and establish refined analytical framework based on scientific evidence and provide convincing explanation. The editorial board of Lancet, we have Mr. Bill Summerskill, but they have a very stringent criteria that we had to fulfill. So our research team conducted various discussions in order to fulfill the criteria. We repeatedly revised and rewrote our paper. And also, in order to collect health data scattered across various fragmented agencies, there was the support from the Ministry of Health, Labor and Welfare, Ministry of Foreign Affairs, JICA, Ministry of Finance. Those support was indispensable. In order to ensure a future organization to communicate policies to the international community, we think it necessary to establish a mechanism or organization that integrates all government-to-government and public-private cooperation to collect and manage health-related data. In the process of assessing the past healthcare system in Japan and identifying current challenges and proposing future policies, the feature of our system identified was good health at low cost with equity. Based on egalitarian principles as such, healthcare cost had to be contained through policy measures, and also to maintain sustainability despite the aging trend of the society, gradual reform was carried out while avoiding resistance from interest groups and suppressing political risk to achieve equity in healthcare access, benefit provision, and patient burdens. So we engaged in a gradual and slow process of a reform in order to cope with the changes of the society, namely aging. However, inequality of premiums, on the other hand, premium rates, has not been improved. By the way, it is very clear that various social factors played a role in realizing our healthy society, which includes political leadership that emphasized people's welfare, aiming for a middle class and correction of social disparity, and also includes the high level of education and economic growth and stable employment relationship. On the other hand, there is an important fact that we cannot neglect. In 2005, in the WHO Assembly, a resolution on universal coverage was adopted to provide access to appropriate healthcare services to everyone at an accessible cost. But already in Japan in 1961, universal healthcare coverage was achieved at a cost of $3,500, which was half of the national income per capita of the UK. So even before the high economic growth period, we had achieved universal coverage already. Japan also succeeded in the 1960s and 70s to establish public-private partnership in health with local schools and to introduce public health approaches such as the salt reduction campaign, and also we improved healthcare access under universal coverage by disseminating antihypertensive treatment and other necessary treatment. We reduced stroke mortality and extended life expectancy in the process. Although universal coverage was achieved by top-down efforts by the government, the effect was enhanced by the bottom-up approach as well, based on partnership of public-private sector involved in healthcare. The combination of the top-down human protection policy at the government level combined with the bottom-up human empowerment policy of promoting public-private partnership in the healthcare sector in the community, this coincides with the core pillar of Japan's official development assistance policy, namely the human security concept, to protect people's lives and dignity by promoting policy decisions at the community level. We believe that the concept of human security is applicable in the area of healthcare in different countries and is a valuable policy concept in the 21st century. And therefore, in session 4 today, we will discuss our role as a mature state in the world in the area of human security and make policy recommendations in this area. In the 21st century, after 20 years of Japan's economic stagnation and expanding fiscal deficit, unstable employment relationship, and rapid aging and political confusion, the sustainability of our healthcare system that supported the healthy society is also being eroded. So in session 2, we'd like to identify the current challenges, and in session 3, we will make policy recommendations for structural reform. In the first session, since the Great East Japan earthquake hit areas with significant aging of the population, we will demonstrate how structural issues of the healthcare system was manifested in these areas after the earthquake and the disasters. So to support affected people and plan for reconstruction, we must engage in structural reform of healthcare system at the national level and in an integrated manner. The incremental, gradual pace of reform is no longer viable. The structural reform is an urgent need that we must address immediately. A larger challenge to achieve this is to stabilize our politics and to establish political leadership with an intellectual ability to plan for the future. The special series is the first attempt to contribute to the international society by a way of policy discussion in the area of healthcare to fulfill Japan's role as a leading mature state. It is also accompanied by a serious message for structural reform to sustain a healthy society in Japan. I would take this opportunity to sincerely express my gratitude to the people of Lancet for giving us this opportunity. And by this, I would like to conclude my presentation of the discussion points. Thank you very much for your kind attention.
Takemi-san, どうもありがとうございました。一日を通しての
Thank you very much, Dr. Takemi. You have clearly identified the theme which is going to be debated throughout the day. In concluding this particular session, I'd like to call upon a special guest. At the outset, I said I recognize Mr. Furukawa, parliamentarian. We don't know what's going to happen to Japanese politics. That's why we didn't print his name in the program. It doesn't mean that he's now having an idle time, but political leadership was mentioned by Dr. Takemi. So nowadays, Mr. Furukawa is going to be even more powerful going forward. So I'd like to ask him to speak for a while. He is serving on the board of directors together with Mr. Aizawa on the Japan Committee for Global Help. Mr. Furukawa. Thank you very much for your kind introduction, Mr. Yamamoto. I am a Furukawa, a member of the House of Representatives. I was here. I came here in order to be an audience, but when I entered into the hall, I was asked by Mr. Yamamoto and Mr. Takemi to say a few words at the outset. I know that the time is running short, so I'd like to nevertheless speak very briefly. Now you are launching the Japan series, Lancet Japan series. This is quite timely, as Mr. Takemi said, this is quite timely, the launching of this Japan series. Dr. Takemi, the people of Lancet, as well as the people who were instrumental in compiling this report, I'd like to pay tribute to each and every one of them. And you are also organizing this international symposium. And I'd like to thank Mr. Yamamoto and JCIE as well as other people concerned for organizing this meaningful symposium. It's been 15 years since I became a parliamentarian. Consistently, I was always working on social security. I did so because I always think this. The diplomacy is the security outward, and then the social security is an inward security issue. And therefore, defense and diplomacy and social security have to be solidly established only when the country can develop and enjoy a stable existence. So together with Dr. Takemi, although we belong to different political parties, we shared such awareness in pursuing our activities hitherto. On the question of healthcare and social security, in general. During the LDP days, there was much discussion regarding the possible improvement and reform. Carrying on that discussion since last year, we've been debating the integral reform of Social Security and tax last year in June between government ruling parties and other parties. We have the draft a plan. Going forward, we will be involving the opposition party members as well as other national stakeholders so that we will have a national debate going forward. We will be facing with various problems. Japan is a front runner with respect to other countries in respect of problems. So sustainable healthcare and the social security model has to be created. It is a challenging work that we are going to embark upon. So at this very important timing, the launching of the Japan series by Lancet is done. It is quite meaningful. So the discussion today would be something that we will bear in our mind in policy debate. Going forward, I hope that not only Japan, but other people, other countries will provide their wisdom in pursuing the global debate so that we can come closer to the future image. I think it is important not only for Japan, but also for the Japanese contribution toward the global debate. In that sense, I sincerely hope that you will have a meaningful discussion today. With that wish, I'd like to conclude my greetings. Thank you very much for inviting me.